Those of us in the field would consider glaucoma an optic neuropathy, meaning there's something wrong with the optic nerve. Most people would associate glaucoma with eye pressure, and that is a risk factor for glaucoma. But the end step in glaucoma is damage to the optic nerve. The optic nerve is the main nerve. I think of it as a fiber optic cable that takes all the information from the eye and delivers it to the brain. So each eye has one optic nerve, and as that optic nerve is damaged by glaucoma, you lose nerve fibers. We are born with roughly 1.2 million nerve fibers in each eye. We will lose some of those as part of the normal aging process, but with glaucoma you lose those in an accelerated manner, and that will generally start to cause peripheral vision loss. However, sometimes the vision loss is central and it's much more noticeable by the patient. It's a dangerous condition because it's common and it does not have prominent symptoms. You do not know if your eye pressure is high. In fact, the eye pressure can become quite high and someone would never know. And the vision loss that people have with glaucoma is very subtle and it comes on slowly. And so there can be significant loss of peripheral vision in somebody that has had glaucoma for a long time and they're not aware of it at all. Elevated intraocular pressure is the biggest risk factor. Family history and age are also significant risk factors along with nearsightedness. In many people it's just genetic and they're going to get glaucoma one way or the other. There's no way they can avoid it. And at a certain age, your years on this earth and genetics will catch up to you and the manifestations of glaucoma will begin. There's other conditions that can cause it. Trauma to an eye could cause glaucoma. Patients with bad diabetic eye disease can end up with glaucoma. There's also exogenous means of getting glaucoma, such as steroids. People that are on prednisone or even steroid drops can get something called steroid-induced glaucoma. Those people that have what we call primary open-angle glaucoma, the hereditary type, there's really no way of avoiding it. The goal would be to identify it early, treat it early, and try to minimize the damage that it has on the eyes. Checking the eye pressure is very important. Getting a good history, family history. If you say, I have several people in my family that have struggled with glaucoma over the years, that's very important. And then the exam with peripheral vision checks. That is a computerized test that we do. There's also analysis of the optic nerve. The thickness of the optic nerve is very important, and we can analyze that using a machine that is much like a CAT scan. So it's essentially a CAT scan of your eye, measuring the thickness of that retinal nerve fiber layer, which becomes the optic nerve.